Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on public health and infectious diseases. I'm pleased today to welcome my friend and colleague, Dr. Jon Epstein, for our weekly episode called Inside Bird Flu, where we discuss the latest news about the H5N1 epidemic in the United States and around the world. Thanks, Jon, for joining me today.
Thanks for having me, Jay. How are you doing this week?
I'm doing well. And, in one of our previous episodes, to those who are astute listeners, you and I had a little back and forth about how we're always presenting doom and gloom.
Yes.
So,
It's a worry, I have to say. I think about this sometimes, but go ahead.
and I think you're totally right. I mean, I think the people that listen and watch us are eager to hear about risk in the world, but I think people are also interested in hearing somewhat good news. So I wanted to start off today at least talking about not so much H5N1, but other aspects of the flu. And kind of the important and good news is that the seasonal influenza season has really looked like it's coming to an end here in the United States. So CDC has a monitoring system, and it updates that data on its website called FluView. Kind of a cute name, FluView. And it says that now that the percentage of outpatient visits for influenza-like illness or any type of respiratory infection has dropped slightly from 2.1% the previous week down to 1.9% last week. And this is part of a trend that's been going on for the past couple of weeks. And it also correlates not just with people visiting their doctor for a flu-like illness, but also the number of patients being hospitalized for the flu continues to decline. And the rate of positive tests for flu is also down from the previous week. So all of that is a really good sign that we're entering in towards the kind of like late spring, early summer months, where thankfully we have to worry less about the flu.
That is good news, Jay. And everything's to be taken in context. Sometimes I worry that we're presenting a lot of doom and gloom, but on the other hand, I think what we're really trying to do here, right? What our objective is to inform people about what's going on and give them the knowledge that they don't necessarily have to worry more about it, but just understand it better.
Yeah, absolutely. And I think this is where data is really so important. And I wanted to highlight a little bit about this for the average viewer out there that, one of the things we like to do on this show is to highlight all the many different ways that people are working kind of behind the scenes quietly without any attention to keep all of us safe out there. And one of the ways they keep us safe is by providing us, with data that we can use to improve our health and protect ourselves. And part of that is this flu surveillance system that I talked about. And it really depends on lots of different layers and lots of different systems where state and local health departments are basically tracking visits to doctor's office to try to see how many people are coming in with a fever and a cough or a fever and a sore throat, either of which could be symptoms of the flu, and collect that data in a really systematic and rigorous way, and then put it up on a website that you and I can talk about it. We can say, hey, the flu is getting worse around the country, or hey, as we're talking about today, the flu is actually coming down.
Yeah. And just to let people know, this doesn't just happen in the United States, but flu is one of those diseases that every country in the world pays attention to, collects data on, and reports those data up to the World Health Organization. So there's even a global level aggregation of data where people are monitoring the frequency of influenza infections, of course, the different strains of flu that are circulating, because don't forget, the flu that we get seasonally here in the United States is, of course, influenced by what starts circulating, 6 or 9 months earlier over in Southeast Asia. So flu is just one of those global viruses that makes its way around very easily. So it's great that we have strong, robust surveillance here in the US, and it's connected to global surveillance too.
Yeah, and I'll do my, regular point that I have, over the past couple of months, which is that this stuff doesn't just happen. Like when I first went overseas for CDC in 2003, this was a lot of the work that CDC advisors in different countries were trying to push, both in the WHO as well as in countries around the world, because a lot of countries said, look, people are dying of HIV, they're dying of tuberculosis, they're dying of a whole range of conditions. Why do we need to worry about and monitor flu? And so a lot of countries, 30 years ago, were not tracking data on flu regularly. They may have had it in a very small site or very small program somewhere just to collect some specimens eventually for vaccine development. But this is something that, CDC played a really critical and important role around the world in trying to get countries to take it seriously. And it's really because of the dangers that ultimately come when you don't have data, when you don't understand how flu moves from season to season, because the pattern that we see in what we call temperate climates like North America is very seasonal, right? There's a very big spike of flu during the colder months, usually when there's lower relative humidity. And there's a quieter period during the other months when there's a little bit more humidity. Now, there is a small spike of a different type of flu, influenza B, sometimes later in the spring and parts of the summer, but those really big flu spikes tend to occur in the colder months. But that's different in tropical settings. And this is something that the work that CDC did helped to discover, which is that tropical climates do have a seasonality to flu, but it behaves a lot more like we see COVID behaving, which is there's a couple of spikes in different seasons throughout the year. It's not just one big season.
That's right. And one of the things that really adds another layer to this whole conversation about human influenza is, of course, what's going on in the animal world alongside us with avian influenza. And I want to talk a little bit about that today too, Jay.
Well, of course, this is Inside Bird Flu, right? So we're going to move away from this like human illness issue now to talk about what's happening in the animals that are out there. And it's been interesting, John. There's been a lot. You and I have talked previously about the issue about how avian influenza isn't just an issue with wildlife, and it isn't just an issue with animals that are raised for food, like poultry and cattle. But it's now really become an issue of pets in our home. And I wanted to highlight a little bit about the issue of cats, because it turns out there's a lot more that we're learning about cats and what happens when the cats get different types of flu strains as well.
That's right. And I think I want to, emphasize too that while we are talking about bird flu in general on this show, you might be wondering, like, do cats get seasonal influenza the same as humans? And the answer is yes. Cats are even susceptible. It's not that common, but your pet cats can theoretically get infected, and some have, with H1N1 or H3N2, which are human influenzas that tend to be responsible for our seasonal flus. H1N1 was the 2009 pandemic strain of flu that went around the world, and cats are susceptible to those viruses. Now, it tends to be mild disease when it gets into cats, unlike avian influenza. So now with H5N1, this is the bird flu that we've been talking about getting into poultry and cows, and we're monitoring very closely in people. When cats get bird flu, it causes more severe symptoms. And so here's where you may notice that your cat has some persistent, severe respiratory symptoms that are noticeable. And also H5N1 in cats presents sometimes as a neurologic disease, swelling of the central nervous system, the brain, the spinal cord, that can cause signs like loss of coordination or balance, head tilting. Cat can be falling over and not behaving properly at all. And this can be confusing because one of the big neurologic diseases we always pay attention to in pets and in mammals generally is rabies. And so it can be very confusing. Now, in a lot of places, most states in the United States require pet cats to be vaccinated against rabies, but nonetheless, occasionally animals can get infected with it. So from a veterinary standpoint, when we start seeing cats or dogs for that matter, but we're talking about cats with neurologic signs, the first instinct is, could this be rabies, perhaps distemper virus? Now, veterinarians have to start including H5N1 influenza as a potential rule out, albeit it's a much rarer one. But nonetheless, as we're starting to see cats get infected, we have to consider that this is one of those things.
Yeah, and I was just, one of the things we were talking about offline was that there was an extensive review recently published by scientists at the University of Maryland, who are really calling for exactly what you're talking about, which is for veterinarians and animal public health systems around the country to really increase their suspicion, basically perk their antenna up a little bit more, and start testing more for influenza in cats, because they found that there has been an increase in feline infections from many different types of these avian influenza strains.
That's right. So one thing that's been, fortunately monitored over time, and this is the paper you're referring to is a 20-year review of incidence of avian influenza in cats. And we see a number of cases are in Asia and other parts of the world where some of them are big cats at zoos like tigers that have been fed chickens that were infected. So we've seen cases there where those big cats have gotten sick and several have died. We've seen cat to cat transmission. Tigers have transmitted H5N1 to each other. And so there's, that worrying phenomenon, because we're always looking at whether avian flu can adapt to a mammalian system. This is what we worry about in terms of ultimately it being able to infect people and spread more easily from person to person. And now what we're starting to see is domestic cats. There are a few instances here in the US of cats getting H5N1, and there's a couple different ways they might get exposed to that. The most direct and obvious one would be if cats are spending time on farms around infected poultry, or even dairy cows are being fed raw milk or colostrum from dairy cows that were infected. That is one possible route of transmission for cats. The other thing we've seen here in the United States is raw pet diets. So this is raw cat food diets that include chicken, poultry, proteins. And if it comes from a farm where there's H5N1 circulation, then that raw food diet is a risk for potentially transmitting to pet cats. And so we've seen a few instances of that as well.
Yeah, I mean, this is, and I think one of the things that I worry about is, back in 2016, at the end of 2016, there was a very big outbreak of a new influenza strain among cats in an animal shelter here in New York City.
Mm-hmm.
And it took a tremendous amount of effort for us to control that outbreak. And I personally was worried that it would, eventually become a human outbreak as well. It did not, which is good. But I think that's one of the other reasons we worry about these infections spreading more among cats is not only are they in our homes, but we also, because of our animal welfare system, we have cats in shelters. And shelters, just like homeless shelters for humans, are a place where infections easily spread. Cat shelters are another possible site of that as well.
Yeah. And I think what this all amounts to, Jay, is really us having to not only remind others, but remind ourselves, influenza H5N1 is a One Health disease. This is one that, we are constantly trying to stay vigilant about human infections and human to human transmission, but we can't forget that this is a virus that right now has been spreading widely in wild mammals and in domestic animals like cattle, poultry, and we're seeing it in domestic cats. And we have to keep our eye on that ball as well, because the name of the game here is making sure that H5N1 doesn't get the opportunity to evolve and mutate to become more adapted to a mammalian host, because what we don't want to see is human to human transmission. And we can't only pay attention to human cases to figure out if that's happening, because by the time we notice it in humans, it's already happened and it's too late. So really, we need to pay attention also to animals that are susceptible and make sure we're doing what we can to monitor it, to diagnose it, and to limit opportunity for transmission among domestic cats. It's harder to do among wildlife, but ideally, we want to make sure that the possible routes of transmission to mammals are limited and the routes of transmission to people are limited too.
Yeah, so I just want to make sure that our viewers get some sort of very practical information today too, especially if they're pet owners. My family, there's a lot of cat lovers in it. Both of my daughters, one daughter has 2 cats, the other one has 1. We used to own cats for a very long time until, unfortunately, they passed away. So if you're a pet owner, when should you be worried about influenza, either seasonal influenza or an avian influenza infection in your cat? And what should you be telling your pediatrician so that they also, as a sort of a reminder, to think about this as well?
Right. It's a good question, Jay. I have 2 cats at home as well. And cats do get respiratory illness. And there are things that are not even related to flu that can cause respiratory illness in cats. So if you see that your cat is sniffling or sneezing, that there's discharge from the eyes or nose, that's a sign that there may be a respiratory infection. And you may want to bring that cat to your veterinarian and have them take a look and diagnose. I wouldn't jump to the conclusion that it's flu, but really we're making the point that, it's something that veterinarians need to keep in mind, particularly if there's a history of possible exposure in those cats. And the second thing is, I would really recommend avoiding feeding raw food diets at this point, because that is a known risk right now. And because H5N1 is really pervasive across poultry farms, and some of those bird proteins might make their way into diets, I'd really avoid raw diets. So flu doesn't have to be the first thing you think of, but if you have cats at home and they're showing respiratory signs, number one, avoid cuddling and getting up close to those cats while they're showing signs of respiratory infection. Number two, good idea to have them looked at by your vet and get some advice on what to do to manage that infection.
Great, Jon. Well, thank you very much for that very practical information. Is there anything else you wanted to highlight for our viewers today?
Look, I think we're going to be talking about this pretty regularly, but it was good today to review what we know about flu in cats, and I think it was important to emphasize that we need to stay vigilant in surveillance, not just in people, but animals too.
Okay, Jon. Well, thank you very much. And thank you to all of you for watching this episode of
On the alarm, Jay. I hear it in the background.
Yeah, it's the sound of living in a city, right? There's humans, but there's humans getting into trouble, and yeah, alarms going off. Unfortunately, I need to be in a soundproof area. If you appreciate this episode, if you appreciate learning about public health and infectious disease, please hit the like button. Please hit subscribe and share this episode with others. And we look forward to seeing you next week for another episode of Inside Bird Flu.
Take care, everyone.